Thanks so much for joining. Happy New Year. Can you believe it's 2023? And we get to start with such a cool topic today on empathetic listening. You guys are in for a treat. We're here with Dr. Jackie Perry. She insists we call her Jackie. So we are so excited to kick off this year with something that we can all really tangibly use and learn from and apply, not just in the way that we advocate for moms, but in the way that we love the people that are around us and closest to us. And really just the responsibility around this topic today is something we can all just get a refresher in. And I think you're going to be really excited about some of the very deep, meaningful, thoughtful content that Jackie has prepared for us today. So without further ado, I want to introduce you guys to Dr. Jackie Perry. Thank you so much for being with us today.
Thank you. I'm glad to be here.
So Dr. Jackie, Jackie is a quick little bio on you. She's a licensed clinical mental health counselor educator, and approved clinical supervisor. She's also the author of a parenting book called Heart Cries of Every Teen. She's excited to combine her teaching and her clinical skills with her faith in Christ to equip people to become better listeners in their families, churches, and the community as a whole. She will be assisted by others who have a passion for this ministry and or have some training or experience in the mental health field. So she's also started and is the founder of something called Soul Well. And Soul Well is a 12-week workshop. It's taught in triads. They basically teach, practice, and observe empathetic listening. So they're equipping individuals to really not just practice empathetic listening, but to bear witness in both their stories being shared and heard in a way that reflects Jesus and in a way that we are all called to. So she has this really beautiful combination of both faith and practice and people and how we love them, how we dignify them in the way that we listen. And it's so interesting because this topic in our field is so critical as we work with vulnerable moms and families. I remember a few years ago, one of our case managers, we shared an office for a season, and she would be on the phone all day and be answering these calls of the moms in our program needing something, needing a sounding board, a thought partner, help, support, a friend, whatever it may be. And there were so many times where it would just be silent in the office and I'd start talking to her and she'd like look over at me motioning that like she's on the phone, but it was just silent because she was listening. And sometimes that's the best gift we can give people, is just this art of listening really well. And it's really hard to do. I don't think it's natural for us to be good listeners. We can all benefit from the art of listening more. So we're excited to learn from you today, Jackie, on this topic. And even when we were doing our run through before this workshop, I was like being really cognizant of like how I'm listening to you because I'm like, oh, she's an expert at listening. And I'm like, pay attention to every word. So I know that's not the heart behind this, but yeah, I would just love for you to share a little bit about you, your background, who you are, and how you got started into this work.
Yeah, I have been a clinical mental health counselor, as you said, working with adolescents, families, emergent adults this is my 32nd year. Probably 10 or 15 years ago, I started kind of transitioning into more of equipping and really wanting to do much more teaching in the community, churches, institutions, all of that. And God called me back to school. I got my PhD in counselor education in 2020. And had been teaching in the university setting a couple years before that, probably 2017. And as I dove back into the world of academia, I forgot some of the training that I had had. And I was like, the first class I was given to teach was called listening skills. And it's fundamental for counselors to learn. It's every social worker, family marriage and family therapist, counselor in their graduate program goes through this skills class, 15-week class. And in it, we teach the skills of listening. And as I was going through this, I was really struck by the fact that, wow, the church would
Mm,
benefit greatly from these skills. It would be wonderful if we can sort of put this together in a way that could equip people to learn how to sit with people who are far different from them in every way.
yeah,
And to be able to do this for the glory of God and for the good of the other and the community. And so that's how Soul Well sort of developed, was with that in mind, using this really a graduate level kinds of skills and combining them with nuggets that we know about mental health, everything from trauma to, well, it starts with the grand narrative of scripture and what is the soul, to
yeah.
shame, trauma, depression, addiction, all of that, these little nuggets. And so those two together are what makes up our Soul Well training.
Very cool.
Yeah.
So let's start with just empathy. When we talk about empathetic listening, can you kind of orient us around when we say the word empathy? What does that mean? Define that for us.
Yeah, so I'm a neuroscience nerd, so I'm going to go right into that really
Let's do
quickly.
it.
Yeah, so when we talk about the word empathy, we often think about sort of like this idea of feeling with, and that's really what it means essentially, is I'm feeling with you what you are experiencing or what you experienced. But when we take it to the level of the brain and we talk about neuroscience, it's really divided into two, and maybe even more, but there's cognitive empathy and there's what's
Mm,
called affective empathy. So
mhm,
cognitive empathy is like, I can imagine that would have been hard for you. I
mm,
can imagine that being in that situation. And so it's much more of our thinking, right? And that's actually not hard for many people to do, is to offer cognitive empathy, like
mhm.
imagining. The other part of that, which is a lower brain function and it moves into our body, is what's called affective empathy. And it's this idea of not only can I imagine, but it's like I'm feeling and I'm actually
Mm,
letting my body go into that story with yours. And so even my heart rate might change. I can still control it, but my lower functions of my brain and body, so into my nervous system, are feeling with you.
yeah.
Um, so that, yeah, I don't want to run ahead, but the power of understanding both of those plays into the power of what we can do as listeners.
Yeah. And do you think that that requires a knowing of how to feel what someone else is feeling when they're sharing with us?
Yeah, yes, it is a knowing, and it requires my physical body. So one of the first things
Mm,
that we do in the training is actually, we don't practice what to say back. We practice a
mhm,
lot of listening, and you're not allowed to say anything other than attuning to what's happening in your body. And the
mm,
reason for that is because we are what's called a left-centric culture. Our world has moved away from this, and we're pretty cut off from our bodies. And it's one
mhm.
of the things that's kind of central to understanding trauma, et cetera. But yeah, so if I let myself go a little bit, and it doesn't require a letting go of, like, letting myself actually enter into this story in a physiological,
Mhm.
emotional way, I actually am sending signals to the person to whom I am listening that are
Mhm.
more important than anything that's coming out of my mouth. But I do just want to emphasize just this idea of cognitive empathy, thinking with, and then this idea of affective empathy, which is often the difficult piece of listening,
Mhm.
which is feeling with. It really does involve my nervous system, my body, and it requires attunement to both my body and that right brain and to right brain connection, which is coming up from my body to the right
Mhm.
brain, is actually the most important thing happening in a relationship. And so affective empathy is so powerful because when I offer that to another, they actually, our brains were designed to mirror each other. And so the person to whom I am listening begins to mirror and feel with me. It's like this back and forth. And then when I move into cognitive empathy, which is upper brain, sort of thinking and analysis, or different perspective, or offering hope or strategies, or all the things that we want to do when we're supporting others, they actually will move with me. But if
Mm,
I don't join in this affective way and I start in this cognitive way, I lose them. I
mhm.
lose them and they're not able to join. And so we now have studies where we have empathic listeners all these wires, and we can show what they're experiencing in their brain, and we can see
Mm,
movement in the brain of the other. And that movement is important for hope, for healing, perspective changing, all of that, instead of where many people who are in pain or
mhm,
difficulty are, which is this place of flooded,
mhm,
just so much emotion, so much pain, and they
mhm.
can't move into this place of sort of seeing things differently.
Yeah,
Um, does that make sense?
totally. Why do you think it's so hard to listen well? And what at times disrupts that process for us to be able to
Yeah,
listen well?
that's a good question. So there's a lot of the biggest reason is we have this incredible thing that God gave us called a brain. And one of the things it does really well is it makes judgments, it's predicting, it's evaluating, it's running ahead for survival
Mhm,
purposes. It's like we are always like running ahead. Like all of us do this, including me.
mhm,
We're somebody's talking and we're already thinking about what we're going to say, right? Or how we're going to jump in or how we can relate to that. And so listening requires us to suspend that, to override this part of our brain that wants to triage, make judgments, make sense of all the sensory input we're having. And so
mhm,
it requires intentionality, like I'm going to stay with the story. I'm going to stay where there are. And so that's very vulnerable for me to sort of go, it's risky for me to sort of go, I'm just going to stay with them. And I'm not
mhm,
going to try to figure out what I'm going to say. It's also where God wants us, right? Because it's
mhm,
like if I can attune to him in the midst of this process, attune to my body and attune to this person, he's actually going to be the leader in that process. It's
mhm,
hard. It's hard to let go. That's one reason. The other, there's a lot of reasons, but the other
mhm,
big reason is our stories come into play. Like I bring Jackie Perry to every relationship. And Jackie Perry has a nervous system that's been patterned by the people who have shaped and informed me. And realize who you are today, every one of you, is a result of every relationship you've been in.
yeah,
God has created us so that our relationships are actually forming us and changing our wiring neurobiologically. And so all of the people who have shaped me have affected my ability to relate to you. And
mhm,
that's wonderful and terrible, right? So if I grew up in a home or have had many relationships where people were not attuned to my emotional or affective state, guess what? I don't know how to do that. I
yeah,
don't know how to tune to my affective state. So then I don't see it in you. I don't know how to
right,
see it in me. I don't know how to see it in you. So our own stories play a role in that as well.
yeah.
And those are probably the two biggest.
And in terms of relationships, how does empathetic listening positively impact our relationships? I think you've started to hit on that. And then also, I'm curious how you think it, when we can't empathetically listen to people, how does it negatively impact our relationships?
Yeah. Well, I think, yeah, I did give you some good nuggets on that. And one of the biggest ways is, again, when I can help somebody move from affective, we connect and I
Yep.
join them, um, then I can help them move to these higher levels of their brain. But let me go to a more fundamental place for just a minute. Our nervous systems from the time we come into the world. My daughter's about to have a baby, and I just can't wait to just offer this to this little baby girl in a couple of
Yeah.
weeks. But our nervous systems come into the world, and they really are asking a couple basic questions. Am I safe? Are you with me? Are you accompanying me? Is what runs some writers say. Do you see me? And we come into the world, and if you all have ever seen a newborn baby, they literally are looking. Who's looking for me? And that's a Kurt Thompson phrase that's quite famous. Come into the world looking for someone who's looking for us. And so one
Oh.
of the things that really impacts relationships is when I can offer empathetic presence. I'm offering this ability to say, I'm with you.
Mhm,
I see you. I'm safe. And it
mhm.
quiets the nervous system so that the person can actually feel what we were created to do from the beginning. From the beginning of the grand narrative, we have this
Yeah.
story of, Adam and Eve in the garden who were perfectly seen and known and loved and beheld by the Father. So let me transition into the second. When I empathically offer that to somebody else in that way, that my nervous system is seeing your nervous system and I'm safe, I'm going to soothe you, I'm going to offer, I'm with you, all of that. What an incredible opportunity to reflect what I experience from my Heavenly Father on a daily,
Mhm,
moment by moment basis to that person. And I don't have to say the name of Jesus. Like
mhm,
the fact that I'm a biopsychosocial spiritual being and I offer that to somebody else is a way for other people to experience the witness of God. Emmanuel with us is in your physical bodies,
Mhm.
experiencing, somebody experiencing that through you,
Mhm.
biopsychosocial and spiritually. So
Yeah.
that was a mouthful, but
Yeah.
hopefully all that made sense.
Well, and do you think it's safe to say then empathetic listening always also deems this ability for us to let go of the expectations
Yeah.
of what we want this conversation or session or mentorship relationship to look like in the end? Like
Yes.
oftentimes in our work with the moms that we get to serve is it's easy that we feel not heard because we've had the same conversation over and over and over again about what you should or shouldn't do, about the choices that you're making. And oftentimes, I think in this space, we feel like nothing's changing. And
Right.
that's not really what it's about in terms of how we build relationship. Is there a natural frustration when we are like very attuned to being an empathetic listener? And then also, how do we let go of that expectation that we also in turn receive that same type of listening?
Yeah. So I don't know if this is exactly what you're asking, but want to go somewhere that's really important and I think is at the heart of what you're asking.
Mhm.
In the class that we offered, and definitely when we do this for counselors, but in the class that we offered, the number one thing we were hearing was, wow, when I actually quiet my, like, say less,
Mm.
and I'm actually attuned to what's happening here, what's happening here, and what's happening here, we're going into spaces I didn't even expect with my children, in my marriage, with my employees. Like, one person said he's older and his kids are grown, but he said, every time I'm doing this now, my employees are crying. And what's happening is we're moving from behavior and exterior to the
Mm.
inner space of the soul that is so longing to be seen. And that is where God forms us. That is
Yeah.
where we have the opportunity to really shepherd deeply. But let's not, like, this is easy to say and hard to do. Like, we are behavioral creatures. I'm a parent of three grown people,
Yeah.
children, adult children. And, I'm always, as when they were here in my home, you're looking at their behavior. You need to be nice. You need to put your shoes away. You need to do your
Right.
homework. And so we become so focused on the exterior that we forget the most important thing is actually what's happening inside, which is actually mind and spirit, mind being
Mhm.
thoughts and emotions, and spirit being, obviously the center core of who we are. So we
Mhm.
get lost in the outside of somebody, the exterior, meaning that what they're doing, what they're saying, what they're,
Mhm.
and we forget the most important thing is what's happening inside. And so when I can quiet myself and just go, Holy Spirit, help me to go into the most deep places. Like, once I'm in that land, that's where
Mhm.
he does, I mean, like, amazing thing, like, stuff surfaces that you weren't even,
Mm.
the underneath, what's driving that behavior, or what's driving that destruction.
Yeah.
If it's something, then you really see the beliefs about self, others, God, the
Yeah.
world, that we really want to kind of get to the core of,
Yeah.
if that
What's
makes sense.
one thing that you could pinpoint for us that we can work on as empathetic listeners, as advocates, as women that are serving other women?
Yeah. So mm, one
It can be
in
two.
two parts. Okay. Yeah, it is, obviously it's attunement to God and his spirit, and that we exercise, we're anchoring ourselves in faith. But in the midst of that, if I'm going to say to all of you, what the most important thing is apart from that is attunement to what's happening in your physical body. And I'll tell you why. Again, it goes back to something I said at the beginning. The most important thing happening in a relationship is the nonverbal communication. And so
Mhm.
even when you're on a phone and you're quiet and you're saying, I'm with you, or definitely in person, they are reading that. The nonverbal part of who I am never lies.
Yeah.
And so that means it's unedited. My words can be like, I love you, but I really, like, I don't, and people
I
feel that. And
don't.
we've all had those moments where people say something and I'm like, why am I not feeling it? It's because it's not true. That's a left brain statement. And it's coming from a right brain body experience that is the
Mhm.
most authentic thing about me. So if I'm not attuned to what my body is saying, I ask people to do mirror work where they're actually looking at themselves in the mirror as they're talking, because many of us, and I'm going to pick on moms, we are
Mhm.
just we have these, like, mean faces, like our resting pose is often, and that communicates a lot. So
Yeah.
attunement to what's happening in my body, and then knowing my own story and how it relates to all of this. Like some people have a really hard time with hearing difficult emotions and they want to
Mhm.
make everybody feel happy. Well, listen, we are in chapter 3 of a grand narrative that we are in between, in the now and not yet. So we've
Mm.
got to invite people into this place where they can feel safe, both hoping and lamenting. And
Mhm.
that's really important. So we've got to feel comfortable with that. And so when
Mhm.
you share and you start crying, if I'm like, I need to make her stop crying, well, that's not true. Then I've got some work to do in
Mhm.
increasing my comfort level in other
Mhm.
people's emotions.
It's
I
not
think I said 3 things. I'm so sorry.
yeah, it's not our job to fix. It's really it's just our job to be with people. Do you think there's oftentimes an emotional cap that we have? Like if we are going to enter into conversation with someone and they start being vulnerable with us, and you're almost in this headspace where you feel like you can't absorb what they're saying because of just our own like inability. How do we respond in those moments and in those times?
That's such a great question, because that's reality, right? Like may have the heart to want to enter your story, but then as you're telling your story, of course, it's activating my own story, and then it's
Mm,
like could potentially flood me. I
mhm,
am a believer in being the most transparent human possible.
mhm.
So even to be able to say, I am hearing you and I am hurting with you. Like I'm feeling overwhelmed. Like it's okay to put a pause, and it's
Yeah.
okay to put boundaries in a conversation. And then it's important for us to do some exploration apart from that person with somebody else who's bearing witness to our
Mhm,
experiences of what we were going through when we were sitting with somebody. I
mhm.
often, a metaphor I feel like the Lord's given me is, I often feel like, if I'm yielded completely to him, I'm like on this little vessel and he's taking me into the space of another. And I don't get full control. He
Mm,
does. And it's uncomfortable and it's foggy. If you picture a little ship in, this foggy land. And then I hit these barriers. And sometimes those barriers are not
yeah.
me. They're the self-protection of the other. And I have to
Yeah.
honor that. Like they don't feel safe. They don't know how to go there. This is going to take a while. We're staying in this exterior, people who vent and vent and vent and vent and vent, and they complain, and you're not getting to the heart of what's going on. That's that wall we
Mm,
hit. But I can only do that yielding as this little tiny rower with
mhm.
God into the center place of another. And it's such a sacred space when you get there. And it's scary.
Yeah, it's vulnerable.
Mhm.
What happens what happens when someone doesn't feel heard? Like, can you give some language to us around we've all felt that, but can you get some language around like when you are being vulnerable and sharing and you feel like someone's looking at you but not listening, not taking in anything you're sharing, what are the repercussions of that in a relationship?
Yeah, I mean, I think the biggest repercussion is shame. What we end up actually fostering and exacerbating the shame that every one of us
Mm-hmm.
battles on a daily basis of like, how silly, I shouldn't have shared this. Probably many of you have been in group settings or individual and you can't wait to open up. And then you realize, I'm getting lectured, or they're now
Yeah.
sharing their own story. And what it does is it's a neurobiological. Shame is not just emotional, it's also neurobiological. It actually closes up the nerve, like the nervous system kind of goes, like
Mm,
we just start going. And then the whole dialogue, like, I feel so dumb. I think they're judging me. Just all the things that shame does. I am bad. All of that. And so we really need to be careful when we're in listening relationships, because we have the potential to actually grow shame in the
mhm,
other person. And that's the opposite of what God invites us to, which is exposure and healing. And when I'm talking about bearing witness, it's like, if I have the chance to reflect the opposite response of shame, whereas if I'm experiencing shame and you look at me as I'm telling my story and you're offering me this compassionate presence, the
mhm,
most loving, even if I'm making a mess of my life, like that's called in the world of counseling an emotionally corrective experience,
mm,
changes neural fibers, it changes the way I see myself. But from a spiritual perspective, it extinguishes shame. Shame
mm,
doesn't survive when our when we are exposing ourselves and we are experiencing love and unconditional love and grace and truth and
Mm-hmm.
presence, it just
Mm-hmm. Yeah.
shrinks, and you
Yeah.
see it. You really see it.
Yeah. What does that dance look like then when like we want you to understand that we are with you and we're understanding what you're saying? And at times we may have shared those same experiences. Is it appropriate to then in turn share from your own experiences or tell your own story? Like, how do you navigate those waters with people that might only want to be listened to, but then also like, is there an element of inspiration or motivation or encouragement to hear, I know exactly what you're feeling, I've walked that same road?
Yeah. Yes. And that is never where we start. And I think that's been a big learning curve for people who've gone through our training, is just, I often start there because I want them to understand that I get them. And
Mm,
that's the wrong place to start. If you want them to understand that you get them and that you see them work on these affective empathy kind of skills, and they will feel it to the core of their nervous system and in the depths of their soul. And yes, it is appropriate for you to say down the road, sort of like,
mm-hmm,
I don't know, a lot of youth ministries say we earn the right to be heard. And I think there's
mm-hmm.
truth in that in all relationships. I earn the right to be heard because I've shown you that I'm safe. You can
Yeah.
trust me that I really do care about your narrative more than mine. This is what
Yeah.
this space is about. And I'm using my own story to join you. That's what I
Mm-hmm.
always say to people, is bring that story to mind. It's okay, but you don't have to name the story. You can actually bring that story to mind and into your body so that you can join them.
Mm,
And down the road, yeah, that's called relational immediacy, where we sort of talk about what's happening between us, or authenticity, where I'm sharing my own story, but that should come further down the road.
yeah.
Yeah.
When in working with people who have experienced pretty severe trauma from childhood through adolescence into adulthood, and then also our own selves and stories having experienced trauma. But when we're working with someone who's experienced trauma, what's the timeline on that? Like, how long do we be in a relationship with someone until you almost arrive at that place where you earn the right to be heard?
That is an impossible question to answer. I would love to
You're
give
like
you a
8 weeks.
timeline, because really,
No.
for some people, you may be the linchpin. Like, they've
Mm,
experienced safety over and over and over and over again. This is the time that they're actually going to sort of lean into that and give, and actually open up a little bit more. But for some people, you may be the first person that has ever heard pieces of or all of some or all of their trauma. And that is a very, especially for people who haven't been in therapy and haven't done some work on their trauma, like, that is an extremely difficult place for the nervous system to sort of put itself out to another. And so the
yeah.
response to that is deep self-protection, because even if you're doing everything right, it's just scary to
Yeah.
begin to name and sit in the stories. We would rather shelve them. And a lot of people still believe like we can compartmentalize and put those stories of our childhood experiences or our relational experiences in a box, and that they never affect us. That is a lie. They
Yeah.
affect every fiber of our being, which is quite sad and also quite wonderful, because that God uses that
Mm-hmm.
in relationships. So
Mm-hmm.
yeah, there's not a timeline.
Yeah.
It requires incredible patience, and I think it requires discernment in terms of like me knowing, like, what's my role in this relationship? It's to be available. And it's okay for me to say, I think I've come to the end of what I can do here. And that's
Mm-hmm.
okay. That's
Mm-hmm.
okay. You didn't
Yeah.
fail. You just, we're part
Yeah.
of the process of God's, how he's working.
Yeah. Oftentimes we're in people's lives for a season. And is that okay? That like we don't have to carry, like whatever our expectation was. And earlier, kind of what you were describing as sometimes we enter into these relationships or conversations with people with our own agenda, and
That's
to lay
right.
that down.
That's right.
And how is God using you and planting seeds? And what does that look like for us to trust that those in due time, like he will finish what he starts?
That's exactly
And
right.
like we aren't responsible for people's change ultimately. Would you agree with that? Like, that's not our responsibility to change people.
No, I 100% agree with that. And people who are drawn to the field of helping, from counselors to all of you as mentors, advocates, often come in because it feels good. I mean, it feels
Mm-hmm.
good to impact people's lives, and it really, really does. And then the opposite of true is like when we're not seeing change
Yeah.
or connection or impact, we realize, okay, what am I doing wrong? And that's like not helpful. And that
Yeah.
actually, that's actually that's coming from our own place of shame. It really
Mm.
truly is. That even that question, like, what am I doing wrong? It's like, wait a second, this is not about right or wrong. It's about sort of being a vessel, an instrument of the Holy Spirit to be
Mm-hmm.
in this relationship. But it is something we battle as humans. Like, it feels so good when somebody's like, I've never told anybody about this. It finally feels safe. You're like, yay. And then you have 20 other people who are just like, that's not happening.
Totally.
Yeah, it fuels our egos, and
Mm-hmm.
it's and instead of sort of like, I am here, do what you want to do, Lord, through me, and I'm yielded, and obviously that's boundaried, and that uses wisdom, and that uses sounding boards to help me understand where I need to sort of step out of this or refer. But yeah,
Yeah.
for sure, I think you're
It's
spot on.
so hard because it is so vulnerable. Even on this call, I'm like looking at my next questions and trying to be fully present and listening in this moment, and how common that is in all of our relationships. That
That's true.
it's almost uncomfortable to let yourself just be fully present and not be planning
Yeah.
your next step, move, word, question,
Yeah.
comment, response.
Yeah, I feel like there's like this invention that can be made. Here's where I dream. Like, could there be something that we sort of like wear or put on our
Yeah.
brain, and sort of we know we're in this vulnerable place. It's a healthy vulnerable that's almost like a thermometer that's showing me, oh, Jackie, you're in your head. Move back
Mm,
into your body. We're such
mm-hmm,
disembodied creatures, and it would be so nice to have like a watch that says, "Oh, you've moved to disembodiment, Jackie. You're back in your head, and you're not
mm-hmm.
present with others." you know, Dallas Willard says this physical body of ours is our portable pot in which the Holy Spirit resides. And
Mm,
it's true. And we need to, this whole portable pot is part of what he uses. He's moving in and through our physical bodies.
yeah.
And but we disconnect from that and kind of go to this head place,
Yeah.
and then we lose our best selves. Super hard
Mm-hmm,
to do. But
mm-hmm.
yeah, just like there are monitors out there for every single thing out there, I just wish there was a way that we could measure that. There probably
Yeah,
is, but
I know. um, we are gonna open it up for Q&A. If you have a question for Jackie, please drop it into the chat. But before we do, what is one piece of advice that you can leave our advocates, knowing the work they do day in and day out? That if there's just one takeaway, what would it be?
um, I'm already showing that I have a hard time giving you one thing. So I want to say this, like, it's so important for me, and I get teary as I say this, to remember on a daily basis, I am his beloved.
Mm-hmm.
I am his beloved. And he says those words, that he said to Christ, "In you I am well pleased." And that actually anchors me in like being able to sort of do this, like remembering that we are his beloved,
Yeah.
sort of takes the pressure off. And the second is like, where has that been disrupted for each of you? And so knowing your story is so important. Like, we're asking people to open up and be vulnerable. And where do you have a cloud of witnesses that is bearing witness to your story and helping you reshape this story so that you are living out of the I am the beloved kind of narrative, place, that you're
Yeah.
offering that authentic presence, and you're not just naming these things that are nice to hear, but you are presenting as one who's beloved because you're doing that work in your own way, shape, and form. It doesn't mean you go into therapy, but it does mean that you are being vulnerable and allowing the Lord to reshape and restore your own
Yeah.
narrative as well. So
Yeah. And Jackie, we would love any recommendations, books that we can send out to our community that you would recommend for us
I
who
will.
are seeking healing and might be in that space of I'm needing to do deeper work on my own soul and heart and mind, and would just love to learn from you in that. So
Yeah, I have some great recommendations. I'll
awesome. Well,
send your
thank
way.
you so much for just sharing and joining. This was such an honor and pleasure.
Thank you. So great to be here with you all.
All right, we're going to go into a few questions. Okay, Lisa says, does trying to repeat what they are saying back to you help or hurt? Example, what I think I'm hearing you say is ...
Yes, yay. Who's the one who asked that question? I'm not.
Lisa.
Okay, Lisa. Oh, yes, yes, yes. That's actually so after we teach people to sort of be in their bodies and be quiet and not say a whole lot, the first thing that we ask them to do is reflections of content, not even emotion, just like not repeating as much as just sort of like, can you sum up what you hear them say instead of
Mm,
responding to it? It's actually so much easier to do that than to figure out what to say. So you just say, so what I'm hearing you saying is exactly that. Or, wow, I hear a lot of confusion and chaos in your world
mhm,
right now. You don't have to say everything they're saying. We can sum it up, but absolutely. We teach people this thing called the listening cycle, and that's the first thing. There's like 5 key stops on this listening cycle. And I always have the class do that listening cycle to me. I pick 5 people and I'm like, I'm going to tell you something I'm battling with. It's not too overwhelming. And then I have them go through the listening cycle. And by the time we get to the last skill, starting with reflection of content, this thing Lisa brought up,
mhm,
I'm always weepy. And I cry
mm,
easily. So, I'm always weepy. And I'm like, look at that. You didn't even have to do anything fancy. And
yeah.
you entered this really deep place. Now I go there, I can go there easily, but it's a great yes. So to answer your question, yes.
Summarizing, Lindy said, are there key phrases we can practice, implement that help others feel seen and heard as they share vulnerable things?
Yeah. So beyond reflections of content, the next thing that we ask, and this is a great place to stay, is between reflections of content, is something called empathic reflections, which is like, this is the formula. You feel blank because blank.
Mhm,
And to add on to that, is it because you value blank?
mm,
Yeah, that is a formula. You're feeling blank because blank. So it's helping people do what sounds very easy for people who do this intuitively, but it's very hard for a lot of people, is to attach the emotions to what they're experiencing. Some people talk heavy in feelings and they can do this well. Many people don't. They're just complaining and complaining. And then you're asking the Lord, help me understand really what they're experiencing. You're feeling unseen
yeah.
because nobody's listening to you. You're feeling dismissed. And to be able to find this really key word, again, many people did not grow up in homes where feeling words were used. And so we have 50, 60, 70-year-olds who are like, I don't know. So when
Yeah.
we help them attach the feelings to their words, it's not just a nice thing. You're actually helping them make neurobiological connections and make
Mhm,
sense. The
mhm,
number one thing, and I didn't say this, it's important to know, but the number one thing attached to well-being and wellness after trauma is coherence. And that means just making sense of your story, being
mm,
able to sort of put it together in a meaningful way. And with Christ added to that, it's actually not just a meaningful way, but a hopeful
yeah.
way. So
Yeah.
yeah, so that's a good formula.
And when you've experienced someone doing that for you, it's life-giving, where you're filling in the blanks, but they're giving you that almost that framework to do that.
Yeah. Yeah.
Uh,
A good example is a lot of people say, I'm just mad. I'm just mad. I'm just mad.
yeah.
And they stay in anger. Anger is a secondary emotion. So it's really important for listeners to know, like, this is an acronym that marriage therapists taught me and my husband many, many decades ago.
Hmm.
So helpful that GIFT, the acronym GIFT, is actually helpful for people to think about. Like, many people are feeling guilt, inferiority, less than, fear, anxiety, or trauma,
Yeah.
which just means hurt, like wounds. And
Yeah.
that is actually the primary feelings that many of us are feeling underneath anger. So if you can, as a listener going, they're really mad, like help them dig deeper.
Mm,
That's what we're training counselors to do, is like, what's the primary emotion? And that's
mhm.
the raw emotion.
Yeah. This is another good question. When others are on a long venting track, is there an appropriate way to truly listen while also setting a boundary?
Yeah, I think one of the things, and this is more of a principle than how to, the principle is actually people, when they're venting, they're staying on the exterior. It's actually self-protective. It's like, "Da, da, da,
Hmm.
da," they're staying out here. And so even the question of like, what are you experiencing? Like, we want to move to what's called inner focus of inward focus.
Yeah.
And a lot of our conversations, and think about it, like when you leave a lunch date or something and you're just like, why don't I feel satisfied? Like I
Mm,
feel it's not even just unseen, but I didn't feel like that was satiating at all. It's because we stayed so much on the exterior and nobody helped me move inward, or I didn't help that other person. Like what's happening inside you when that happens, and
mhm,
helping people sort of move to this place in time, right? Like if
mhm.
somebody's venting and I start going right there, it might just be like, well, why are you cutting me off? So we let them vent a little bit and then just say, wow, that's a lot. Like what happens inside of you? Like, what do you notice? Like, what emotions do you have? What are you feeling when that's happening? In
Yeah.
anything that brings them to inward focus, I often will ask the question, what does this remind you of? Where
Mhm.
else was another time where you felt like the same emotion?
Like helping them make that pivot versus digging in with more questions about, and then what happened?
Yeah. Yeah. And then it becomes a blame game and sort of
Yeah.
pointing the finger. And that's important to listen to. But it's also like what I really can offer somebody is let's kind of explore what's happening in you
Mhm,
to help you feel seen.
mhm. Okay, next question from Kristen. What do you do when you haven't practiced this, but you still have opportunity and now want to better serve the mom? What's the best first step after time has already passed not doing it? So if you feel like I've not been doing this well in my relationship with my mom and now I want to begin.
Oh, I mean, I think you begin. I mean,
Yeah.
I think you just begin with the basics. Like, I think a good basic is I'm going to turn down the volume on how much I say. Like, one of the things we have counselors in training do is they have to do these transcripts, and we actually have them figure out the ratio of how much the person is speaking versus them. And we
Mhm.
want that down, like they're speaking to be down. So that's a great place to begin. Listen more, talk less. The next place would be just practice reflecting what they're saying back.
Mhm.
One of our participants in our pilot training that we just did this past fall said, I was just going crazy. I just want to practice. And so I was at a Starbucks and I thought, I'm going to practice with the girl who's giving me my coffee. And I said, how are you doing today? And she just started going off. And so she goes, I just was giving her reflections of content because that's all we had. And she goes, the next thing you know, I felt like we were going to like move into she was opening up about her
Some
life. And
deep
so she was like,
experience.
I didn't have to do anything. And she said, my old
Mm.
me would have been like, oh, I'm so sorry. Or is
Mhm.
there any way you can get off work early, or helping her solve the problem versus all she did was reflect back and
So easy to go to
yeah,
solving. Yeah,
yes, yes,
that is so funny.
yeah.
Um, Hope says, what if they begin to share things that are bigger than something you can handle, like domestic violence, sexual abuse, suicidal thoughts? What do you do and how do you help while still making them feel safe?
Um, yeah, two couple things. Yeah, you need to know where your limits are. At the
Mhm.
same time, I mean, one of the things we're trying to do in Asheville is try to start this center where I believe ordinary people can actually make a dent, really an impact in this
Yeah.
area. But I do think when you're feeling flooded and you see that person feeling flooded, and a great way to look at it is sort of if you scale yourself and scale somebody from 0 to 10, and you're feeling your nervous system feeling overwhelmed, even if theirs isn't, probably that's a great place to go, hey, can we do this in pieces? I feel
Yeah.
like this is a lot. This is a lot for us to talk about. I wonder if we can just sort of focus in on this piece.
Yeah.
When a person is telling their story and they're sort of above a 6 or 7 on terms of a scale of 1 to 10, and what I'm talking about is like they're starting to panic. You can see that they're not doing well. You're actually not doing a lot of good, particularly
Mm.
as a listener. You really want to keep them at this place where they're doing small bits at a time. But when somebody feels safe, there is this like, I just want to vomit all of this and share all of it with you because you feel so safe. And it's coming from this deep longing to be seen and known. So name that. I want to be seen and known. You want to be
Yeah.
seen and known. It's so important. I wonder if we could do this more effectively in little pieces,
Yeah.
and to know when to refer,
Yeah.
when to refer to somebody that's a professional, because trauma is something that we understand so much more about than we did
Yeah.
10 or 15 years ago. And there are better ways than just talking to deal with
Mhm.
trauma.
Yeah. Um, Dr. Perry does run these 12-week workshops again called Soul Well. And so when we asked her to come do this, we were like, can you fit everything in your brain in 1 hour for our advocates. And she said, no, but I can give you the highlight reel. So this is, if you're interested in doing the deeper dive and learning more about Soul Well and the workshops that they offer, we just strongly encourage you guys to check it out. We will be sending out a follow-up too with that information, so you guys can have it on hand. But we would just strongly encourage you, if you feel any kind of pulling to dive deeper into this empathetic listening space and what that really means and requires of us, and just to learn all of the really deep work behind it, then we will give you that information. So as along with all other readings or recommendations or anything else that she will provide, we will get into your hands. So this was just scratching the surface, the tip of an iceberg of really great work. So thank you again, Jackie, for being here. It
Thank
was
you.
so enlightening and really valuable for all of us to learn from
Thank
you.
you. It's a privilege.